Welcome back to Street Soldiers. I'm your host, Lisa Evers. And in this episode, we are talking about a very important issue to ourselves and our communities. It's about smoking. Maybe it's time you stop if you're smoking right now. If you have loved ones, I mean, we've all had boyfriends, girlfriends, husbands, wives, kids, relatives, people that are smoking, and you're around them and you're like, why don't you quit? There's so much information about how much damage this does. And then there's one excuse after another. Well, there's no excuse for it right now for not stopping. That's because the City of New York, the Health Department, has a program to help you stop smoking for New York City residents now through May 7th. All you have to do is call 311. Tell them you want to stop smoking. They will mail nicotine patches and chewing gum to your house. It can't get easier than that. You don't even have to go anywhere to pick it up to help you stop. And all you have to do is call 311. Now, we've got a lot of different aspects of this issue that we're discussing and that we're focusing on. So, Jen, let me start with you in terms of where are you in your quitting smoking stage?
It's been 4 years smoke-free. 4 years since the last time I started, or quit rather. And then overall, I mean, my first attempt to quit successfully was 9 years ago. But it's been only 4 years that I've been smoke-free because
you tried and tried again.
I quit successfully, but then I say I fell off the wagon, and then I started again. So when people ask me how long it's been, I don't know. Has it been since the last time I smoked a cigarette, or has it been since the last time I actually initially started my quitting journey?
What was the hardest thing for you about that?
I think it was the habit, waking up in the morning and not smoking a cigarette after my breakfast, or having my coffee or no cigarette. That was the hardest part. And then of course there was the physical cravings that I had for about a couple of days afterward, the headaches and the crankiness. Actually it was more like a week.
What was it that gave you the edge the last time that you were successful? Like what was the difference between that attempt and the previous attempts that had failed?
I knew I was seasoned. I was seasoned in quitting. I knew what to expect. I knew what was going to happen. I knew that I was going to want to eat. I knew that I was going to get cranky. I knew that I was going to have to find something else to do with my time again and retrain myself to live life without smoking. So I guess the second time around, I kind of learned from my mistakes the first time around.
So you knew what to expect and you kind of anticipated it.
Correct. And I think that made the second time, I don't want to say the second time was easier to quit, but it made it more manageable to quit the second time around, and it's been 4 years so far.
And you used the patch, right?
I tried the patch at one point, yes.
And did that help you?
For a while it did. It did. For a while it did.
It got you through the rough spot.
Yes.
You ate, especially when you ate. I think that was like medicine. You know, they tell you have to take your heart medicine after every meal. That's what a cigarette was. You know, I felt lost. You know, if I had 2 cigarettes, I would make sure that I saved one so I'd have one after I ate. I mean, how crazy is that, right? That really is. But, you know, that's what you go through. It was like, you know, the meal wouldn't be satisfying without that cigarette.
Because that was like the perfect ending.
That was like, you know, the perfect ending. You know, that was it. I'm at peace now. Do whatever you want to do with me. So, I mean, that's the crazy thinking that you do. You know, like you really couldn't digest this food and enjoy it without having that cigarette at the end.
Absolutely. Jen, what about giving birth or quitting smoking? Which one was tougher?
Up until I had a baby 5 months ago, quitting smoking was the hardest thing I had to do. The thing about having a baby, they gave you drugs for that, so it wasn't as bad. I think that if I had the drugs to get over the post-initial after quitting cigarettes, I don't know what my answer would be. But, I mean, it's up there. The quitting smoking is up there with the baby. Having the baby, I mean, the 2 hardest things I've done to date.
Do you wish that you never started?
That's a really tough question because I really like my cigarettes. I really like smoking.
You still like your cigarettes?
I'm not. Yeah, I do. I mean, I still, smell people. I still smell it. I was telling Marie earlier, when I'm in a car and I'm driving my car and there's a guy smoking a cigarette in front of me on the highway, I smell it through I actually smell it coming through the air. So, and I almost smell it. You know the movie with Anthony Hopkins and Jodie Foster, where he played the cannibal? Do you remember at one point he was just able to smell things in the air? Like he was able to smell things like her perfume. He smelled it through the glass. That's how I feel when there's cigarettes around. I can almost smell it I could just be sitting somewhere and say someone's smoking somewhere. So I'm very sensitive to it. So to answer your original question, I don't know that I miss it. I do miss it, but I don't really foresee myself picking up another cigarette because I think it was a big accomplishment on my part, and it would be kind of silly for me to start again.
Definitely. Alex, what about you? What's your what stage are you in in your relationship with cigarettes?
I am about to go into the Gen stage. So I started smoking as a teenager, stupidly, and wish I never started. It's just one of those things where it's, you know, it was random. It was to be cool. It was among my peers. I didn't drink. I never did drugs, and smoking was kind of the thing. And you always think as a teenager, oh, you know, I'll quit before I'm not going to be an adult smoking. And of course, it's that addictive. And I was successful in quitting for a number of years, and you know, I think that was really, you think of cigarettes as your friend, unfortunately. You think of smoking as your friend, that moment that, you know, you have a breakdown or a bad day or something happens, it's, let me go have a cigarette. That's kind of, that was my time. You time your day by cigarettes, like you know, both of them have spoken about, you know, the pre-meal, the after meal. I could tell you some other afters that.
Yeah, we know that one. We know that one too. But if you want to go into detail, but it is Sunday morning, so.
Yeah, so, you know, I think you have to transition in your mind. I think it's really a psychological relationship, because the actual event of me quitting, I worked up in my mind just how hard and how difficult it was going to be, because everyone tells you how hard it is, and I'd been smoking for a really long time. And other than that, I'm really healthy. I work out every day. I watch what I eat. I don't drink. I'm ambitious. That every other part of my life I feel.
And you read
successful.
labels on food things, right?
Yeah. And so, right. And you know, in Canada, actually, they have big warnings on all the cigarette packages telling you, you know, smoking causes cancer, smoking kills your baby, smoking, you know, and people still buy that, and that's just, it is addictive. But I do think it's a much more mental addiction, because the moment that I was determined that I was going to quit and that smoking was not going to be more powerful than me, I came to the realization that it controlled me, I didn't control it. And I'm a control freak. So to think that something else was controlling me and my time and how I time my day, it was like a ball and chain. It was like this thing that, you know, I just felt like I was a prisoner of, and I just didn't want it anymore. And I just quit cold turkey. And the first 2 days were kind of tough. And after that, every day I was more proud of myself, and I felt better. I felt like my skin was better, food tasted better. My breathing was, everything, life was just better, and you really feel uninhibited, and it's just this big freedom. Being a smoker, there's nothing nice about being a smoker. It doesn't look cool, it's gross, it smells gross, you know, it tastes gross for the most part. Like it's just, there's nothing appealing about it, and on top of that, it kills you, it causes cancer. You know, I'm also a vain person, and I don't want to look 60 when I'm 50.
Right, exactly.
You know, there's a lot of harsh realities to smoking. And
so what's your game plan now to beat it?
well, I'm definitely going to use 311. It's really because of the New York City Department of Health that I'm quitting now. That, you know, I was like, it's an opportunity. This is.
We're doing the whole show. We're doing the whole campaign on the station.
Coming
everything.
to me in my life at this time for a reason. It's
Right.
been on my mind for months. I've been leading up to, you know, wanting to quit. Set the date. And there's just no reason to procrastinate. Like, it's here. I just need to face it. I just need to do it. And you know, I'll use whatever support I can use to do it.
What do you, Beth? In terms of the, you know, what's available again, I want to let people know. And then also with kids, is it common for children who see their parents smoking for them to smoke later?
Yes, that's true. Actually, children who grow up watching their parents smoke are more likely to become smokers themselves. So setting an example for your kids is very important, and I would encourage anyone who has kids. I would encourage everyone, but especially those who have kids in their home, to quit smoking. And they can get help with that by calling 311, and we'll send them nicotine patches and gum at no cost to their home. No one has any excuses to not call 311.
Health Department, remember, if you want to quit, now's your chance. New York City residents, from now until May 7th, call 311. Tell them all you have to say to the operator. This is the easiest thing we've ever had to mention on the show. Just say, I want to quit smoking. They'll plug you in. Boom. You're going to get the nicotine patches, nicotine gum mailed right to your home. How easy can it get? Beth, thank you very much for being with us. We appreciate it.
Thanks so much for having us.